Welcome back, YouTubers, to my channel of An Everyday Life of an Aspie. As you're following me right now, or you've just come to my channel, I welcome to the new episode with open arms, and hopefully that you guys are taking of interest of what I'm sharing right now, of whatever I'm sharing, be it my everyday life story with AS that you can relate to or share with others, or just maybe you just come up to my channel for the reason of maybe you need some form of encouragement, guidance, support, whatever. So here I am with one of my own being, basically here not to judge or criticize. Also to the old beast, welcome back. Basically, hopefully for these videos they're informative enough and dedicated enough for you to actually motivate you in one way or another, basically. So enough further ado, as I was mentioning before in the last part, I'm doing, hopefully it's going to bring out some of the parts of this, like side effects of certain medications that many people may take, be it whatever it may be. But the first one was all about the depressants. Basically that covered basically what the clinical name is, the side effects of the long term versus the short term, and the withdrawal effects of it, basically. And basically now this part 2 is the prescription drugs, basically what you may not know or haven't even heard of or got told by a medical expert. So here goes. Due to the potential for abuse and addiction, many prescription drugs has been categorized by the US Drug Enforcement Administration in some category, in the same category as opium or cocaine. These include Ritalin, Dextran, which are the stimulants, and painkillers, which includes your Oxycontin, Demerol, and Rexenol, and all the like. Basically anything ending in O, like your Tramadol, Panadol, obviously, as we know, used as painkillers also. Basically, so like I said, more in the piece, hopefully, with Ritalin and the like of these ones that I'm addressing to you all right now, of my uptake of it. Many illegal street drugs, however, were at one time used or prescribed by doctors or psychiatrists or any other medical expert out there, but were later on being banned when evidence of harmful side effects could no longer be ignored, to the point where basically, you know, as we know that certain drugs and medications do has its common effects for long-term and short-term effects for us, you know, and many people tend to take on board that it doesn't always work that way, but basically that's fine, you know. But hey, just be aware also, before I continue, I'm no medical expert, I'm just here to pre-warn and actually educate you all on certain topics that I feel close to my heart right now, basically. But I don't condone anyone to either self-harm themselves or whatever, you know, just to seek medical help if and when needed, basically, if you feel that you need it, or even if you see the clinical signs or symptoms of what I share of the previous videos, to seek the help that needed, because this needs to be addressed of all these everyday topics I'm addressing right now. Anyway, continuing on, the types of abused prescription drugs that are involved in this is basically are taken for recreational use today than ever before, be it your cocaine, methamphetamine, and the like. I'm trying to remember all these class drugs that I've learned in high school as well, that has been used as, you know, street drugs versus your party drugs and whatever for recreational use. But you got to be in mind though, there's a lot of other common drugs out there that we are used for recreational, and it's easily accessible, sadly, and basically, you know, within havoc, if all the time needs be, many people tend to, when it's easily accessible, can be easily made into something else, you know, and change the name and make money out of it, and it's happening everywhere at the moment, probably behind closed doors without us knowing. But anyway, the types of abused prescription drugs, as addressed, as I said before, the major categories that are actually I'm going to describe are into 4 types, which number 1 is your depressants, as I said before, how it works, which basically involves in the central nervous system, which is your brain and nervous system, that slows down the brain function, obviously, but it also includes sedatives that are used to calm down a person, and then the drowsiness from it would be the form of tranquilizers under this, which is intended to reduce tension and anxiety, supposedly, you know. Number 2, the opioids and morphine derivatives, generally referred to basically as painkillers, used to relieve pain sort of thing, contains opium or opium-like substances in that form of a drug there of the prescriptions. Number 3 is your stimulants, class of drugs that increases energy and alertness, basically, which can also then increase your blood pressure and heart rate and also your breathing. And the last but not least, number 4, your antidepressants, as I addressed before, which are your psychiatric drugs that's supposed to be handled with depression and handled with care, with people that are depressed and the like. Well, basically that ends part 2 so far of what I've researched so far of the medication side effects. Basically, give me the thumbs up for support and also just liking it. Also, basically, feel free to follow me on Twitter and Facebook, AspieAnswersAll. Feel free to subscribe to my channel if you haven't done so already for more weekly updates or daily updates depending on my schedule. I'll keep it rolling with certain topics that people really want me to address that's close to my heart as well as to theirs, basically. Also, feel free to follow me on Twitter, Facebook, or private message me on AspieAnswersAll on my Facebook page if you need someone to talk to or what have you. Basically, that's what I'm here for, to talk, encourage you all. So, love what you do what you love, forgive yourself, forgive one another, love yourself, take care of yourself. Until next time, thanks for watching, and I'll see you all soon.